Hi, good morning. Thank you for joining us for today's curriculum webinar. We'll get started in just a minute. Good morning, everyone. Thanks for joining us for today's webinar. My name is Eve Velotis, and I'll be your host for the webinar today. We're very excited to talk with you today about the exciting curriculum changes that SCNM will be starting with the fall class in just a couple of months. Many of you probably received the email outlining the changes, but we wanted to have this opportunity today to talk about those changes in greater detail and have an opportunity to answer your questions. So I'm so pleased that you'll be hearing from Dr. Thompson, our Dean of Instruction, about the exciting changes that will be starting in just a couple of months. So before we begin, though, let me take a second to familiarize you with the platform that we'll be using for today's webinar. First, make sure that your control panel is expanded. There should be a box like the one shown in the upper right-hand corner of your screen. If you don't see the box, look for a double arrow. Click on the arrows and the box will expand. Hopefully you're seeing my desktop that shows the image of the webinar control panel, and that's of course how you'll view today's presentation. You will have the opportunity to ask questions. And to do that, you'll type the questions into the box indicated here on the screen. Your questions will be answered verbally at the end of the presentation. We anticipate today's presentation to run about 50 to 60 minutes, about 30 to 40 minutes of presentation, followed by plenty of time to answer your questions at the end. So during today's webinar, you'll be hearing from Dr. Thompson. Dr. Thompson is Professor and Dean of Instruction at SCNM and serves on the Board of Directors of the American Holistic Health Association. He holds a PhD in biochemistry from Loma Linda University and is also a licensed doctor of chiropractic. Dr. Thompson has researched a number of pathologies including breast cancer, asthma, and bone disease. Utilizing a multidisciplinary approach, this has resulted in multiple publications in the fields of bioinformatics, biophysics, biochemistry, cell biology, and tissue engineering. He has been recognized with numerous accolades for his teaching, and in addition to his other publications, he's authored a textbook on biochemistry, as well as a chapter on alcohol, tobacco, and drug abuse in the textbook Introduction to Public Health for Chiropractors. Dr. Thompson has worked very closely with our faculty and others in academics on the changes that you'll be hearing about. So we're very excited again that you've joined us this morning, and with that I will turn it over to Dr. Thompson to talk with you about these exciting changes.
Thank you, Eve. Good morning, everyone. I'm very excited to share with you some of the changes that SCNM has made in the curriculum that will take hold starting this fall. So here's a quote, actually, from our Chief Academic Officer, Dr. Clark, and she says, "Curriculum revision is never finished." And if you've ever met her, you've probably heard her say that. The curriculum is always being revised and always being improved, as well as it should be. We're always undergoing a series of continuous improvement. But our goal is to offer the best naturopathic education we can and to produce the best naturopathic doctors. So one of the first and probably the biggest change isn't just to the curriculum, but it's to the overall calendar. Our academic calendar now has 4 4-week quarters. So you can see here in the graphic that currently we're working on a 12, 12, 12, and 8-week quarter system, but we will be switching to 4 11. So I put the graphic on here so you can see that the pie chart is a little, well, it's poorly distributed in terms of the number of weeks in each quarter. But in the coming curriculum, you can see that every quarter is evenly distributed. The reason I did that was because I wanted to point out that, well, there's two major correlates that go with that. First is that we now are moving our winter entry cohort to a spring entry, and I'll come back to that in a moment, and the cohorts will remain separate, meaning that these two entering classes will never merge together. So in the current system, what we have is, for instance, the fall entry cohort enters, and then we move to the winter, and that's the second quarter for the fall students, first quarter for the winter. Moving to the next quarter, it would be the third quarter for the fall students, and the second quarter for the winter students. And right now what we have is an optional summer. So for the fall students, they don't have to take that summer class, so they've taken the summer quarter, so they've taken 3 quarters worth of classes, and it's during that 8-week summer quarter that students from the winter entry class take their third quarter and catch up, meaning then that both cohorts merge together to start year 2 and continue on together through years 2, 3, and 4. Well, you may have noticed then that here the fall entry students have 12 weeks to finish their third quarter of classes, whereas in the summer, the winter entry students only have 8 weeks. While students performed about the same academically, this was a very stressful situation, and the faculty decided that it would be better to normalize it so it's 11 weeks per quarter. So now, in the new system, we have the 2 cohorts entering, one in the fall, one in the spring, and they will just continue through their curriculum, and they will never meet and never merge. Another major advantage here is that the way things currently are on the left, if a student has to take a leave of absence, they won't be able to rejoin another cohort for 3 more quarters, whereas in the new curriculum, students will be able to sit out just 1 quarter and then join the cohort right behind them. Going back to here, there's a couple of dates that I want to make sure that everybody knows about. So we have 2 entering cohorts, one in the fall and one in the spring. Fall classes begin October 6th. There is a mandatory student orientation that is the week before that, September 30th to October 3rd, so please plan on being in town. For those of you that are entering in the spring, classes begin April 13th, but again, please arrive early. Orientation begins on April 7th. Okay. So let's move back to here. Okay. Let's look at a little more detail of what the curriculum is. So there are 3 major classes that run through year 1. So we have the basic sciences, and I'll explain those in a little detail in a moment. Then we have a clinical practice series of courses, and then we have our history and philosophy series of courses. So these 3 tracks run through the first year. So the basic sciences, well, what we have are, okay, biochemistry, microbiology. I didn't list research here, but we also have a research track. And then we have a course that we call human biology, or HUBE for short. And what this is the anatomical sciences as well as physiology. So by that I mean anatomy, histology, embryology, and physiology. In those courses, there are laboratory components. So we have the cadaver lab, and we have physiology lab, and histology labs, and so forth, as well as an application component. And by this, what we mean is a team-based learning session. So usually these are held on Friday. And for those of you that have done TBL before, you know that the idea is to take the information that you've been learning all week long and apply it in a new way that you haven't yet thought of. So for instance, you might be challenged with a clinical case. And in that clinical case, you will be expected to individually and in teams work out solutions, maybe a therapeutic approach, or maybe some sort of clinical reasoning as to why a diagnosis or something to that effect. So in the first year, we have the basic sciences, the clinical practice courses, and the clinical practice courses we start in Q1. We're very proud to offer those courses, some clinical courses in the first quarter. You get your stethoscope and your Sphyngo, and you start taking blood pressure and listen to heart and lung exams and so forth. So you really start beginning your clinical experience right off the bat and tying the information back to the basic sciences, as well as getting your history and philosophy of naturopathy. Moving to year 2, you move away from the basic sciences, meaning the normal, and move into the abnormal or the pathologic state. So in the general medical diagnosis courses, you are challenged with not only just pathology, but also interpreting that pathology. So coming up with differential diagnoses based on lab values, for instance, or radiographic analysis or other sorts of imaging studies. So moving from normal to abnormal and differential diagnosis. Your clinical practice courses also run through the second year. So you have a total of 6 courses of Clipper or clinical practice. Also in the second year, you begin some of your therapeutic courses. The naturopathic scope of practice is very large. There are many different therapies that are available to the naturopathic doctor, and so you begin your classes in therapeutics in year 2. We also have selectives. Selectives, they are required electives, but you get to choose which ones you want to take, and those are in the different therapies. So there are selectives that are didactic, meaning that they're classroom-based, and then there are some that are very clinical-based. In year 2, you're not yet allowed to take the clinical ones, but in years 3 and 4, you will. So moving into year 3, we start to move out of the classroom and more into the clinic. So we have our first clerkships. In addition, we have a series of courses, general medical practice. So those courses might include things like rheumatology or EENT, so some of the specialties that you might see in practice. You continue on with therapeutics courses. You also then are allowed to take more selectives. You can take them either in the classroom or the clinical setting. And then year 4 is where we round it all out. We have, again, you have more clerkships. Continue on with your general medical practice courses. Finish out your therapeutics. And if you have any selectives left, this is where you would take those. Okay, so one thing that, like I mentioned, we're very proud of, we have a lot of clinical experience in the curriculum. So in years 1 and 2, like I said in the Clipper courses, you will learn your medical equipment, and you will learn how to use it and how to correlate your findings with conditions. We also have field observations. Again, something that we're very proud to offer. There's studies, there's evidence to show that students who participate in field observation have more successful practices. And so as part of that, we've included that in the education here. You are exposed to the medical center. We have a medicinary where you will do a medicinary post and a lab post. So you'll be exposed to formulations and filling prescriptions and IV. And another thing you will have, beyond just practicing with your classmates in the lab setting, we have standardized patients. Standardized patients are essentially actors and actresses who are very good at pretending that they have a certain condition. So as part of your clinical training, you will then work on real people who are acting out a condition so that you can diagnose them, you can take appropriate histories and intakes, and then you can come up with the management plans. In years 3 and 4, this is where you actually do real clinical work. So you do go into the medical center, now first as a secondary, which means that you work with a primary student and the supervising doctor, and then you become a primary in year 4. We have a number of community clinics, and I have a slide outlining exactly what those are in just a moment. You can also, you work closely with your physician, and like I said, on real patients. So this is just showing that we do strongly embrace the team-based learning model here at SCNM. Our faculty are experts in this. Our faculty have been trained and continue to receive training in this area. Another approach to the education here is to have a systems-based education. So you can see our courses, like human biology, which runs through year 1, general medical diagnosis through year 2, and the clinical practice courses, which run through years 3 and 4, are all body systems based. So you move through different body systems, which is what you will be doing in a clinical setting, because a patient will complain of a particular condition that affects a body system. Therapeutic classes are also organized by body systems. We are proud to say that we offer the most clinical experience of all the accredited ND schools. Beginning in the first quarter, like I mentioned, you take Clifford or clinical practice courses. We have 44 hours of field observation built into the curriculum. There are 24 hours of lab posts and medicinary posts and IV posts. Our program is set up to be progressive in terms of your clinical exposure. So starting off, like I mentioned, working initially with your classmates, then with standardized patients, and then on to real patients as a secondary and then a primary. Here are the extended sites, the community clinics that we are affiliated with. While these aren't their names, I just want to share with you that there are a lot of options for you once you get to the end of your education. You can work outside of campus in substance abuse clinics or pediatric medicine, community health. We have a domestic violence center that we're affiliated with, an HIV/AIDS treatment center. We have many doctors who are approved for you to work in their offices just in the local area. Then there are also other places outside of the local area that you can work in. So a major change specifically affecting the new class coming in the fall is that our human biology has a new look. In the current curriculum, human biology is a very large class. In it are the anatomical sciences, physiology, biochemistry, microbiology, and research. So what we've done is we've pulled out the microbiology, biochemistry, and research, leaving the physiology and the anatomical sciences, with the goal of, number one, not having such a large course with so many credits, but increase accountability for the course content. This, we are convinced, will better prepare you for the NCLEX exams, as well as for the clinical setting. We also have a capstone that's at the end of year 1. This is a cumulative course of all the basic science content, and is going to ask you to be able to demonstrate competence in this knowledge before moving to year 2. Now that might sound scary, and it's not meant to stop you from progressing. It's meant to correct any deficiencies before you progress through the curriculum. The NCLEX exam, if you aren't aware, well, there's 2 of them, and they are the national licensing exams that you need to pass. So we have now some dedicated courses in the curriculum for NCLEX review. If you enter in the fall, you would take the NCLEX in your second summer, the end of your second year. So what we have in that summer is the first 3 weeks are dedicated to NCLEX review. There are no other courses, with the exception of selectives. There are no other courses that are being offered at this time, so that you can focus all of your efforts, all of your energies toward making sure you know this knowledge, right, and can show it on the first NCLEX exam. We also have an NCLEX 2 review course, and you take NCLEX 2 just after you graduate. So the NCLEX 2 review course is offered at the end of the 4th year. Now those of you that are entering into the spring cohort, we also have those NCLEX 1 and NCLEX 2 reviews. They're just not going to be in the summer, they're in the winter. So everybody gets exposed and takes these courses. They are graduation requirements, so you are required to take them. But they're for your benefit. This is a very exciting change. We are now offering a 5-year program. What this means is you have a choice. You can choose to enroll in a 4-year program or the 5-year program. And the 5-year program, the years 2, 3, and 4 remain the same. It's only the first year that changes. The first year is essentially split in half. The basic sciences are split where in the 5-year program, the first year would be everything except for Hubie, and the second year would be Hubie. So this offers an alternative for students who either are struggling when they enter into the 4-year program, they can move into a 5-year track, or you may be interested in just enrolling in the 5-year program straight away. Maybe you have, for instance, a large family or other obligations and responsibilities. Maybe you're a non-traditional student, meaning that you are coming in without a strong science background. This may be an option for you. It allows more time for you then to focus on each individual subject, and it's designed to support your success in the curriculum. So graphically, this is what this looks like. So in the 4-year plan, you can see the basic sciences. You have the biochemistry, microbiology, and research, and Hubie specifically split up there, as well as the clinical practice and history and philosophy courses. So that would be what you would take in year 1 of the 4-year program. In the 5-year program, it's basically split in half, and you can see that you take the biochem, micro, and research, as well as Clifford and history and philosophy in year 1, and in year 2, that's where you get the rest of the human biology. We want to give you the best educational experience possible. We want to produce the best naturopathic physician possible. And so all of these changes are designed to support you and your learning and your success.
Great. Thank you so much, Dr. Thompson. That was very informative. So now we want to turn it over to you and answer your questions. So if you have questions about what Dr. Thompson just outlined, be sure to type them into the box and we will start answering them. So the first question is, Dr. Thompson, can you talk a little bit about how current students were involved in the revision process?
That's a good question. So SCNM values the input from the entire campus community. So while the faculty were the main drivers of change, student input was very important and came at several different steps along the way. So we have a curriculum committee, for instance. There are student representatives on the curriculum committee, and so their voice is heard and they have voting rights. We also had a calendar committee as we moved to the 411 weeks quarters. So students had a say in that as well. So not just students, but everybody on campus has their voice heard. That's a good question. Thank you.
Absolutely. So the next question is around the 5-year program and how that option will affect student loan options for students. So student loans will still cover the 5-year program. Of course, because you'll be on campus for an additional year, there will be some additional tuition, but it will not be equivalent to another full year of tuition. And we'll be announcing that tuition number very soon. Our board of directors meets in June, and we're waiting for that meeting to finalize those numbers, but we'll be able to share those with you in the next week or so. But very good question. Dr. Thompson, can you also talk about how you, just a little bit more about the breaking up the Hubie block and how that will increase student accountability?
So imagine a course that's 27 credits. And in that course, while it's body systems based, you're responsible for anatomy and physiology and histology and embryology and biochemistry and microbiology. It would be possible to pass the course and maybe even do well in the course with some deficiencies without being strong in all of those subject areas. And so what we want to do is we want to ensure that our students are strong in all of those areas. And so by pulling out some subjects, for instance, biochemistry. Biochemistry is supportive of body systems, human biology. Is understanding how proteins transport molecules, for instance, is important to lots of different body systems and is supportive of the anatomy and physiology. So pulling that subject out of human biology made sense and allows it for accountability because that's its own course, but it also then provides a way to support the human biology sequence. And the same is true for microbiology. Microbiology may not necessarily fit into every single body system, but is supportive, does general principles that are supportive of all of human biology. So that was the thinking by pulling those classes out.
Great, thank you. The next question is also about the FiveYear program, and the question is the first summer in the FiveYear program still optional?
Good question. I didn't go into all the details, but the short answer is no. Our fourth quarter, which is the summer for the fall entry students, that summer quarter now has a different look as well. In that quarter is the Capstone that I mentioned, and we also are moving forward a little bit the general medical diagnosis courses. So that summer is definitely full of good science content that you are required to take.
Great, thank you. The next question is also about the FiveYear program, and that is what does a student need to do if they're interested in that? And it's really just as simple as talking with your admissions representative. So another question about the FiveYear program, will it reinforce a greater potential learning of the content of the courses? And I think, well, I'll let Dr. Thompson answer that, but yes.
Well, yeah, yes is the answer. So if you're taking, the idea is that your credit load would be reduced by about half. And so then that frees up a lot of time to focus on the courses you are taking. So the idea is with that added time, maybe with the added reflection, the added help that you can get from our supporting everything on campus, that you will perform better. And that's the idea. We're trying to support your student learning.
Absolutely. So Dr. Thompson, you talked a little bit about the first year and the Clifford Class, and there's some questions about what that is. If you could talk about Clifford and how we give students clinical experience on the first day of class in some greater detail.
So it's a good question. The Clifford Class is both a classroom component and a laboratory component. And so, as such, you will be exposed to a wide range of topics. While this may not seem especially clinical, there's issues like ethics. How do you manage patient intakes? Practicing intakes and histories and questions and the motivational interview, for instance. You also are responsible for purchasing your medical equipment and learning how to use it. So you will be looking in eyes, ears, noses, and throats. You will be palpating different parts of the body. You will be, developing your tactile skills as well as your, visual and you're honing in your doctor skill. And so a lot of it at first is awkward, to be quite honest. And so exposing you to this very early on helps develop the confidence that you will need when you get to the clinic setting. And actually, this is something that students from our previous curriculum have said, that the students who are exposed to the clinical or the Clifford courses in the first quarter are much more confident in the clinical setting than those students that came before them.
And anecdotally, I'll just share that I was talking with one of our first-year students just earlier or late last week, and she said that over her break, she went down to do a Naturopaths Without Borders trip, and there were some representatives from other schools there who are also actually a little further along in the program, and they were really looking to her in that respect because she felt very comfortable interacting with patients and doing some very basic things that they weren't even quite yet comfortable doing. So it really does create the confidence in our students and really prepares them to step into clinic in years 3 and 4. So additional questions. So the announcement, you'll hear more information about tuition. We'll probably do some information about that on our website and via email. But if you're interested in the FiveYear program, I would definitely reach out to your admissions representative and let us know that you're interested in that so we could share greater information with you about that. There's also a question, sort of what other impetus led to the FiveYear program, whether it was student health or student stress. And I can let Dr. Thompson address that. But I think it was really primarily academics and just making sure that students had the ability to grasp the information, since so much is offered in that first year.
Yeah, that's exactly right. I mean, realistically, what we're focused on, and what you're focused on as you enter into school, right, is the academic success. However, we do realize that life is life, and so there may be health issues, or there may be family issues, or unforeseen, problems and so forth. So the FiveYear plan does offer flexibility not only for, say, the non-traditional student who wants to go a little slower, or the student who doesn't perform well who is routed into the FiveYear track, but it also provides that flexibility for everybody when life happens.
Great. Thanks, Dr. Thompson. There's also a question if any of the prerequisites have changed in order to apply to the school. And no, at this time, the prerequisites that are listed in our view book and on our website are accurate. But if you are a couple years out from applying, I would definitely encourage you to stay in touch with your admissions rep to make sure that they won't change in the future. We don't anticipate any changes, but sometimes faculty comes back and says, this is something that needs to be added. But we always want to make sure and always are really committed to communicating that to prospective students with as much advance notice as possible so you can be well prepared. But no, at this time, no anticipated changes to the prereq. How far into the four-year program can a student choose to transfer into the five-year program? That's a really great question. Dr. Thompson?
It is. And so, again, the five-year program, it takes the first year and splits it in half. So say you finish the first year. Well, there's no such thing as a five-year program anymore. So it would have to be within the first year. And realistically, sooner is better. If you are struggling very early on, this would be an opportunity to improve your student learning, right, and to take the five-year option. We do have a 4-week course at the very beginning of the curriculum that will help you identify your strengths and weaknesses and might actually be impetus for you to opt into a five-year track if you're struggling at that point. So we do try to help you identify if that would be a wise option for you or not.
Great. We have another question, switching gears a little bit to the calendar, and that question is, how long are the breaks between each quarter? So Dr. Thompson and I are both looking at each other. The breaks are still, you'll still have so in the old, so there's been a couple changes. So you'll still have, actually, you want to
take okay. So basically, there's 52 weeks in a year, and this is 44 weeks of instruction, right? So that leaves us with 8 weeks. And ideally, it would be split, the breaks would be 2, 2, 2, and 2. However, because of where the NCLEX, the national licensing exams are in the quarter, I believe it's like 1, 2, 3, and 2. So it's not exactly a 2, 2, 2, 2 split. But I'm sorry, I don't have the calendar in front of me to say exactly where the 1-week and 3-week breaks might be.
So I can answer that. So the 3-week break is around the Christmas, New Year holiday, so you'll have 3 weeks then. And then the 1-week break is the switch between the summer to the fall quarter. And there's actually a link to the calendar in the email that you received telling you about this webinar. So you can click on that and see the calendar as it's been published. If you have deleted that email or can't find it, again, email your admissions representative and we'll be able to send that to you. Okay, any other questions about either the curriculum or the calendar? And as you know, hopefully you've been working with us for a while, we are always here to answer questions after the fact. So if you think of something after today's webinar, be sure to just get in contact with your admissions representative and we'll be able to answer that. Okay, well, it doesn't look like we have any other questions. So feel free to keep typing if you do, because I'll answer them. But at this time, I really want to thank all of you for taking time out of your busy schedule to plug in and listen to the changes. We're very excited about them. Again, I know that faculty, academics have been working long and hard on these changes, all in the spirit of improved student learning, and we're super excited. Okay, I did see a couple more questions come in, so we will revert to those. So will there be more selectives with the extra year?
So let me answer that. It's not really an extra year. What you're doing is you're taking the same curriculum, the same graduation requirements, the same number of credits, and splitting them up over an additional year. So while we have a list of selectives that are available, you will still have the same list of selectives to choose from to meet your graduation requirements. So there's still a limited number of selective credits that are required for graduation. I think that's the answer.
Absolutely. So there's also a question about this webinar being posted on our website for viewing later, and yes, it will be. It will be posted in the webinar archive section that we on our website. So you can definitely look back for that probably in about a week or so. So there is another question about how our curriculum compares to clinic time compared to some of our sister schools. And I'll defer to Dr. Thompson on that.
Well, every school is a little different. So the only way we can gather that information is by looking at the published curricula of those schools. And our clinical experiences are varied and early, and that's what we're so proud of. So we have not only the clinical experiences in the clinic where you're seeing patients, but we start in Q1, with the Clifford classes. We have the medicinary post, in the lab post, the IV post. We have the field observation and so forth. So it's the wide variety of these experiences, as well as the early exposure to them, and our large number of community clinics that we're affiliated with that really support. So in terms of answering it by the hour, I can't do that. I hope that answered your question.
Great. Thanks, Dr. Thompson. Okay, so there is another specific calendar question around break rotations, and let me reread the question. So on the calendar, somebody sees break rotations, but it's during break week. So does that mean we don't have classes but are potentially in rotations in the clinic?
Right, that's a good question. So currently there are a limited number of required break rotations that you must fulfill. And the reason for that is we want to keep our medical center open during the break. And if all students go on break all the time, we don't have the people to man it. So we split the responsibilities among the students by having a limited number of break rotation requirements. Keep in mind that we are still also teaching out the current curriculum. So as we move from 12 weeks to 11 weeks, and as those students have to meet the number of clinic hours that are required for them, that they will have a different look in the clinic setting than you might.
And I think it's also important to clarify that break rotations really just apply to our students in the 3rd and 4th year. Right. So as a 1st or a 2nd year student, you don't have rotations in the clinic, so that wouldn't affect you for the first 2 years or the first 3 years of the program if you choose to do the 5-year plan. Okay. All right, last call for any additional questions. Okay, well again, as I said, we are always here to answer your questions if you think of something else. And the webinar will be posted on our website probably in about a week or so. So let me again thank all of you for taking the opportunity to dial in this morning and listen to these exciting changes. Let me take an opportunity to thank Dr. Thompson for spending time with us. He's a valuable and such a great resource for our students. And if we in admissions can't answer one of these questions, we'll surely defer to Dr. Thompson and his team and get you the information that you need. So thank you again so much. We're looking forward to seeing many of you in the fall or in the winter. And for those of you that are still maybe a few years out from applying, again, be sure to be in touch with us as you move through the application process. Thank you again so much. Have a wonderful day. And like I said, be in touch as you have additional questions.
Thank you.
And this concludes the webinar. Thanks very much.